Tuberculosis is a major public health challenge in Malawi, with the burden of the disease affecting many communities across the country. Despite progress in the recent years, the prevalence of TB in Malawi remains high. The World Health Organization estimates that 363 per 100,000 people were infected with the disease in 2018. This highlights the need for continued and sustained endeavors to control and prevent the spread of the disease. In an effort to improve and strengthen the health sector's response to tuberculosis and occupational lung disease, the World Bank, the African Union Development Agency (NEPAD), and the East, Central and Southern Africa Health Community launched the Tuberculosis and Health System Support Project, otherwise known as the SATBHSS, in 2016. The SATBHSS is implemented in 4 Southern African Development Community or SADC member states, amongst which Malawi is included. 3 implementing agencies were involved in bringing the vision of the SATBHSS into fruition in Malawi, namely the Ministry of Health, the Ministry of Natural Resources, Energy and Mining, and the Ministry of Labour. The Ministry of Health is responsible for developing, reviewing and enforcing health and related policies for Malawi's health sector. Through its efforts and contributions, the ministry played a vital role in the implementation of the SATBHSS initiative.
Southern Africa TB Health System Strengthening Project is a wonderful project and has been very helpful to Malawi's health systems, especially in the fight against tuberculosis. It has improved the way we prevent, we diagnose, we treat, and also the way we do research around TB, including the issues around surveillance. The good thing about it is that it has helped Malawi build relationship with its neighbors. There's at present quite a lot of cross-border collaboration because of this project, because if a case of TB, for example, is identified in South Africa or in Mozambique, we're able to continue the care here because we are all linked up through these projects.
The SATBHSS project has supported Public Health Institute of Malawi across all the 3 divisions. That's the epidemiology and surveillance, the laboratory, reference laboratory division, as well as the research division. The project has supported us, especially when it comes to cross-border surveillance. It supported establishment of cross-border zones and also committees where we are able to interact with our neighboring districts in terms of surveillance and outbreak investigation and response. And it's also supported coordination meetings at the national level where we're able to engage with our counterparts as well. And in addition, we have a laboratory and surveillance community of practice. And from here, we've been able to interact with our counterparts and also to actually learn some of the things in terms of how surveillance and outbreak investigation and response is happening in the neighboring countries.
Before the start of the Southern Africa TB and Health Systems Support Project in 2017, some of our indicators are the treatment coverage for TB was at 57%, and the treatment success rate was at 87%, and the incidence was around 575 per 100,000 population. The case detection for Malawi continues to improve. For example, if you talk about the treatment coverage, 57% in 2017, the current one is at 70%. We still have to move forward, but I think the project has contributed significantly in increasing the case detection. The project has assisted us in diagnosis. For example, we have mobile diagnostic units that we're using. There are 7, and recently we have bought 5 with the support from the World Bank to make it 12. So these mobile diagnostic units are going city to city, going to different mines, workplaces to make sure that the case detection goes up. We have also supported the community initiatives like hospital motion points. With the support from the project, we have supported close to 1,500, and those initiatives have helped us significantly to raise the case finding. The project has moved us from 87% in 2017 to 90% as of 2022, and that 3-point increment is huge if you talk about tuberculosis. So we think that the project has significantly helped us in that regard.
The Ministry of Natural Resources, Energy and Mining focused on effectively reducing the impact of TB in the mining sector. Together with the Ministry of Labour, their contribution in the SATBHSS project brought about monumental changes in legislation to minimize the impact of TB in Malawi's labour force.
One of the components from this project, Southern Africa Tuberculosis Health System Support Project, was to strengthen our legal framework. And indeed, the project has supported us a lot in the development or review of these legislative pieces. Workplace safety compliance in relation to TB. Through the support from the project, we have seen quite an improvement, because before the project, we really had problems to visit these workplaces, especially those which are at risk for TB. But since the inception of this program, we have reached quite a number of workplaces, especially those maybe there's dust and the like which can cause TB, like the quarries. A total of 207 workplaces have been visited. In our follow-up inspections, we have seen quite an improvement from recommendations which we gave for remedial actions.
The impact of the Southern Africa TB and Health System Support Project in Malawi has been the reduction in the incidence of tuberculosis by 31% if you compare with the 2015 baseline, as well as the reduction in TB-related mortality by 43% if you compare with the 2015 baseline, as well as the introduction of the occupational safety and health services in our country. I would like to say thank you to AUDA-NEPAD, as well as the SATBHSS for the support they've given us, coordination as well as technical support. I would also like to thank World Bank for the huge financial contribution that they've given us. 44 million over the past 7 years is huge, and it has made significant impact on our country.